फंडामेंटल ऑफ डायबिटिक न्यूरोपैथी। फंडामेंटल ऑफ डायबिटिक न्यूरोपैथी। क्लासिफिकेशन। सोमाटिक के अंदर आएगा पेरिफेरल नर्वस सिस्टम, पेरिफेरल नर्वस सिस्टम में आपका आ जाएगा पेरिफेरल न्यूरोपैथी। ग्लोव एंड स्टॉकिंग। डायबिटिक एमियोट्रोफी। मोनोन्यूरोपैथी के अंडर आएगा मोनोन्यूरोपैथी। उसके अंडर आएगा कार्पेल टनल सिंड्रोम। फेमोरल, सियाटिक, ulnar, lateral popliteal, popliteal, truncal, cranial nerve 3 and 6, mononeuritis multiplex, multiplex। सेकंड में आएगा सेंट्रल नर्वस सिस्टम, क्रैनियल नर्व 3 and 6, डाइप्लोपिया। सेंट्रल नर्वस सिस्टम, क्रैनियल नर्व 3 and 6, डाइप्लोपिया। नंबर बी, विसेरल। हे भगवान। ऑटोनोमिक न्यूरोपैथी। डैमेज टू nerve that control the internal organs, जैसे कि आपका कार्डियोवास्कुलर, कार्डियोवास्कुलर, गैस्ट्रोइंटेस्टिनल, जेनिटो यूरिनरी, स्यूडोमोटर, भासोमोटर, स्यूडोमोटर, भासोमोटर, न्यूरोएंडोक्राइन सिस्टम, क्लिनिकल फीचर ऑफ ऑटोनोमिक न्यूरोपैथी, क्लिनिकल फीचर ऑफ ऑटोनोमिक न्यूरोपैथी, क्लिनिकल फीचर ऑफ ऑटोनोमिक न्यूरोपैथी। कार्डियोवास्कुलर सिस्टम में पोस्चुरल हाइपोटेंशन, रेस्टिंग टैकीकार्डिया, फिक्स्ड हार्ट रेट। कार्डियोवास्कुलर सिस्टम में पोस्चुरल हाइपोटेंशन, पोस्चुरल हाइपोटेंशन, हाइपोटेंशन, रेस्टिंग टैकीकार्डिया, रेस्टिंग टैकीकार्डिया, फिक्स्ड हार्ट रेट। जीआईटी में डिस्फाजिया ड्यू टू एटोनी, जीआईटी में डिस्फाजिया, डिस्फाजिया ड्यू टू एटोनी। गैस्ट्रोपैरेसिस, 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 इसमें आपका फुलनेस, नोजिया, वोमिटिंग, नोजिया, वोमिटिंग ड्यू टू delayed gastric emptying, gastric emptying, nocturnal diarrhea, nocturnal diarrhea, incontinence, incontinence, constipation, constipation, जीयू का मतलब जेनाइटो, जेनिटो यूरिनरी, इरेक्टाइल डिस्फंक्शन विथ रेट्रोग्रेड इजाकुलेशन, इम्पोटेंस। जेनिटो यूरिनरी में इरेक्टाइल डिस्फंक्शन, ईडी विथ रेट्रोग्रेड रेट्रोग्रेड ejaculation, ejaculation, impotence, impotence, difficulty in micturition, difficulty in micturition, difficulty in micturition, incontinence, infection, incontinence and infection। पिपिलरी में डिक्रीज्ड साइड, डिलेड और एब्सेंट लाइट रिफ्लेक्स। पिपिलरी, पिपिलरी, पिपिलरी में डिक्रीज्ड साइज, डिक्रीज साइज आपका डिक्रीज होगा, delayed, absent light reflex, absent light reflex, pseudomotor, अरे pseudomotor, pseudomotor में gustatory sweating, gustatory sweating, nocturnal sweat without hypoglycemia, nocturnal sweat without hypoglycemia, without hypoglycemia, anhidrosis and fissure in feet, anhidrosis, anhidrosis and fissure in feet, fissure in feet, vasomotor में loss of skin vasomotor response, loss of skin vasomotor response, ये कोल्ड फीट में होता है आई थिंक, डिपेंडेंट इडिमा, डिपेंडेंट इडिमा due to loss of vasomotor tone and increased permeability, bullous formation, heart rate, okay. Other differential diagnoses are other differential diagnoses are diabetic amyotrophy, it is an acute asymmetric focal onset of pain followed by weakness. It is an acute asymmetric focal onset of pain followed by weakness involving proximal leg with associated autonomic failure, and weight loss progression occur progression occur over month and is followed by partial recovery in most patient. In most patient. Peripheral occlusive peripheral occlusive vascular disease. Peripheral occlusive vascular disease. Peripheral occlusive vascular disease, POVD, clues that the patient has neuropathic pain. Clues that the patient has neuropathic pain. Neuropathic pain are the location of a pain feet more than calves. Feet more than calves. The quality of a pain. The quality of a pain and the timing of a pain. Timing of a pain present at rest improves with walking. Present at rest. Present timing of a pain. Present at rest improves with walking. Improve with walking. Postural or orthostatic hypotension. Postural or orthostatic hypotension. Orthostatic hypotension. Postural or orthostatic hypotension. Orthostatic hypotension is defined as a fall in blood pressure of a greater than equals to 20 mmHg systolic or greater than equals to 20 mmHg diastolic. हे प्रभु. Orthostatic hypotension is defined as a fall in blood pressure का गिर जाना. fall in blood pressure of कितना greater than equals to 20 mmHg systolic or greater than equals to 10 mm Hg diastolic within 3 minutes within 3 minutes of moving within 3 minutes of moving from from supine from supine to standing position to standing position. इसमें ट्रीटमेंट जनरली क्या होता है? स्टॉप्स एनी ऑफेंडिंग ड्रग लाइक अल्फा ब्रोकर, स्टॉप एनी offending drug like alpha blocker, levodopa, risperidone, olanzapine, diuretics, tizanidine, sildenafil, nitroglycerin, amitrin, selective serotonin reuptake inhibitor, calcium channel blocker, increase salt and fluid, OR stocking, fludrocortisone acetate for patient with volume depletion, synthetic mineralocorticoid which increases blood volume, fludrocortisone acetate, fludrocortisone acetate for patient with volume depletion, synthetic mineralocorticoid which increase blood volume, for patient with volume depletion, synthetic mineralocorticoid which increases blood volume. Start with tablet से स्टार्ट करोगे 0.1 mg per day in morning and increase to 0.4 mg gradually. Very important. Check seated and supine Seated and supine BP both can elevate and look for edema. Check seated, check seated, check seated and supine BP both can elevate, both can elevate, both can elevate, both can elevate and look for edema, and look for edema. साइड इफेक्ट इसमें क्या क्या आएगा? हाइपोकैलेमिया, हाइपोकैलेमिया, इडिमा इसमें आ सकता है, कंजेस्टिव कार्डियक फेल्योर, सीसीएफ, सुपाइन हाइपरटेंशन, सुपाइन हाइपरटेंशन, hypertension, if does not tolerate, if does not tolerate, give alpha adrenoceptor agonist, give alpha adrenoceptor agonist, that is midodrine, midodrine 2.5 से लेकर के 10 mg TID, मैक्सिमम 40 मिलीग्राम पर डे, मैक्सिमम हो जाएगा 40 मिलीग्राम पर डे. अवॉइड इन CCF, avoid in congestive cardiac failure, hypertension, urinary retention, टैबलेट कैफीन 100 से लेकर के 250 mg TID with meals may have. 1 cup coffee contain 85 mg and tea contain 50 mg of caffeine. Tablet caffeine, tablet caffeine 100 से लेकर के 250 mg TID आपको देना पड़ेगा with meal may help 1 cup coffee contain 85 mg and tea 50 mg of caffeine. Prevention of postural hypotension. Prevention of postural hypotension. हे भगवान, Stand up slowly, especially in the morning on getting out of bed. Stand up slowly. Stand up slowly, especially in the morning. In the morning on getting out of bed. On getting out of bed. Get up, sit, wait, put leg down, wait, slowly stand up, holding to something. Do avoid fall in case you feel dizzy. Get up, चला. Then sit, बसा. Then wait करा. Put leg down, put leg down, wait, slowly stand up, slowly stand up, holding to something. To avoid fall in case. To avoid fall in case you feel dizzy. Do dorsiflexion of the feet or hand grip exercise before standing. Do dorsiflexion. Do dorsiflexion. Do dorsiflexion of the feet uh, or hand grip exercise before standing. Before standing. Tensing the legs by crossing them while actively standing on both legs. Tensing the legs tensing the legs by crossing them while actively standing on both legs. Avoid flat position. Avoid flat position. Avoid flat position. Sleep with head end of a bed rest. Sleep with head end of bed रेस्ट 35 से लेकर के 40 डिग्री with blocks kept under the leg of cot. With blocks kept under the legs of cot at the head end. At the head end. Avoid running. Avoid running, hiking, or doing work in hot weather. Or doing work in hot weather. WATHER. Weather. Drink enough fluid. Drink enough fluid. Drink enough fluid. Avoid alcohol. Avoid alcohol. Wear compression stocking, especially the ones that go to your waist. Wear compression stocking. Wear compression. Wear compression stocking. Wear compression stocking, especially the one that go to your waist. Prevention of long-term complication. Prevention of long-term complication. Prevention of long-term complication. Strict glycemic control. Strict glycemic control, जो कि आपका HbA1c वैल्यू लेस दैन 7% आना चाहिए. Keep BP below. Keep blood pressure below 140/90 mmHg. Correct dyslipidemia. Correct dyslipidemia. Angiotensin converting enzyme inhibitor prevent neuropathy and reduce cardiovascular event. Angiotensin converting enzyme inhibitor, that is ACE inhibitor. ACE inhibitor prevent neuropathy and reduce cardiovascular event. Reduce cardiovascular event. Neuropathy. हे भगवान, हरे कृष्ण. Neuropathy. Do annual testing for microalbuminuria in all diabetics, starting from diagnosis. In all diabetes, starting from diagnosis and in pregnancy. Measure serum creatinine yearly. Measure serum creatinine yearly. Treatment to reduce proteinuria. Treatment to reduce proteinuria. Start either losartan, LOSRA, losar, SAR, losar, losartan 25 mg से लेकर के 50 mg ये ओडी लेना चाहिए। एनालाप्रिल 1.25 से लेकर के 5 mg पर डे, या तो ये ले सकते हो या फिर ये ले सकते हो। अगर ये नहीं मिलेगा तो फिर कैप्टोप्रिल आप ले सकते हो। कैप्टोप्रिल 6.25 mg से लेकर के 25 mg पर डे इन 4 डिवाइडेड डोजेस। प्रभु। देन गैस्ट्रोपैरेसिस, डायबिटीज मेलाइटस का कॉम्प्लिकेशन कब खत्म होगा? ओके।